Good morning, everyone, and thank you all so much for being here, particularly, of course, our governor, our school superintendent, Dr. Steve Schneider, the president and CEO of St. Mary's Hospital. We are thrilled to be here with all of you to show the work that's been done, but I would be remiss if I didn't mention, first of all, our Connecticut State Health Department and the collaboration and the work that our Emergency Management Director, Adam Renko, has been doing. I was talking to the governor. We've actually started meeting on a regular basis the first week in January with regard to COVID, and we've met every week, sometimes twice a week since. But the health department, the fire department, school department, the school nurses, and our firefighters, our EMTs, and even some police officers who are trained to give the vaccine. So as I was explaining to the governor, our goal here, when we have the supply, we just don't have it yet. So this week, we were grateful to get 800 vaccines for this site, which allows us to give about 135 a day. Post got 1,000. That site got 1,000 yesterday, so that's great. So they'll give out their 1,000 this week, and hopefully next week we'll get more than 800, and they'll get more than 1,000, and we'll grow. CHC is contracted with the state. They're the folks that are doing Rentschler Field right now. They're set up over at the mall. Right now they're doing testing, but they're full bore, ready to go to give vaccines as well. It's just a matter of getting the vaccines. We're patient. Our goal is to have all the infrastructure in place to do 15,000 vaccines a week. We have that in place right now. We have the staff to staff 24 hours a day, 7 days a week. They're ready to go. We have all of the volunteers who have been amazing. We have our local health department, and their leadership has been absolutely remarkable. And so, Governor, we're ready to go. But the one thing that we've found in the short time that we've started the vaccines is we're not getting into those hard-to-reach neighborhoods. So our answer to that is starting next week, we're going to do mobile pop-ups. We're going to go into all of our senior buildings downtown Waterbury. The example I'll give you is this. 44 Center Street is a building that houses 140 folks. 40 out of those folks are over 75, but only 3 of those folks, as of yesterday, have gotten their vaccines. Why? There's a lot of reasons. Mostly because they're afraid. It's winter, they're disabled, many of them, it's slippery outside. They're just not ready to take the chance. So we're going to go to them. We're going to start going to them next week. We're going to put flyers under every door in that building next week on Monday, and we're going to set up appointments for the 75 and older crowd on Friday. But while we're there, we're not just going to do the 75 and older crowd registration. We're going to register everyone in the building age appropriate so that we'll have their name and their contact information, and as they become eligible for the vaccines, we'll be reaching out to them to get them their appointments so that we're going to do that with every building in downtown Waterbury, and we're confident that we'll reach the population that we need to reach with that strategy. After we do all those buildings, then we're going to go further. We're going to go into some of our congregate housing areas, such as the apartments, Harris Circle, Gilliard Drive, Truman Apartments. We're going to go into those types of areas where we know we have a lot of grandparents watching grandchildren, and we know that they're unable to get to these sites as well. So we're going to go to them as well. So we've got a really good plan in place. And by the way, actually, it's an honor. I serve on the allocation committee. Governor appointed me to that. We met yesterday, and it is a very anxious time. Let's be honest about it. And we're all wanting to get more product. We understand that. But we're ready to go, and the state of Connecticut has been our partner from the very beginning. And it is no coincidence that the state of Connecticut has enjoyed a very, very low infection rate due to the leadership of Governor Malloy and the State Department of Health. That is a fact. Did I say? Who did he say? Governor Lamont. That does slip out every once in a while. Only kidding. Through Governor Lamont's leadership, that'll be in the brass tacks, Paul. Through Governor Lamont's leadership, there's no question about it, that we have done made amazing strides. And in this city, with our elderly population, and of course a lot of our elderly population is in downtown, a lot of them, as I mentioned to you, Governor, a lot of them are disabled. Whether they're physically disabled or have other disabilities, those are the people that we really need to reach, because that's where the infections are spreading quicker. So without further ado, I would like to introduce now the CEO and President of St. Mary's Hospital, our partner here at WAMS, Dr. Steve Schneider.
Thank you, Mr. Mayor. I appreciate that. And I just wanted to say we've done a lot of collaborative efforts together with the city over time, whether it's Naugatuck River cleanup, whether it's all of the testing sites that we've worked on. But this one is one that I am probably the most proud of that I have been. It really shows how the city and the hospital and the city can work together. And also it helps us to make a statement that St. Mary's is absolutely part of Trinity Healthcare, but we are St. Mary's Hospital. We're Waterbury's hospital, and it's just an honor and a delight to be partnered with the city as effectively as we have been. Really thanks to Adam Ranko from the city, to several of our people at the hospital, but I'll point out specifically both Shauna Edwards and Amanda Strelakis, who have done amazing work in collaboration with the city to get people through. I've already started to get letters from people, and it's only been open about a week or so, saying what an amazing, smooth operation it is. And seeing it with our own eyes, it's absolutely true. We're making getting vaccinated as painless as possible for our city, and I'm really proud of that. And there's a lot of other people I haven't mentioned, but you know who you are, and you've done work behind the scenes for a long time, making things happen. Very appreciative. And Governor Lamont, the leadership, I want to echo what the mayor said. The leadership you've provided in this state is something that we are all grateful for. Many of us owe our lives to you for your action, for your not being afraid to take on challenges, and for really being willing to get down in the trenches, talk to people. As we took a tour, I heard you talking to patients and citizens who were just coming through for their vaccines, and you related to them the way you've related to this entire crisis, which is magnificent. I'm just very proud to be part of this collaboration, so thank you all.
Thank you, Doctor. So without further ado, I'd again like to thank Governor Lamont. He has been a frequent visitor to the city of Waterbury since being elected in office, and our working relationship couldn't be any better. But really, honestly, to echo again what Dr. Schneider said, if you watch what's going on nationally and you see how this COVID has been handled by different governors throughout the country, you will see that in Connecticut there's been a steady rudder. And because of that steady rudder and courage, let's be honest, when calling here on March 16th and saying we weren't going to have a St. Patrick's Day, that took a lot of courage here in Waterbury, a lot of courage. But that's what it takes. That's what it takes in a pandemic. And as Dr. Schneider mentioned, hundreds, probably thousands of lives have been saved because of that courage and that leadership. Governor Lamont, please step up.
Hey, thanks, Neil. And first of all, Bernard, I love coming back to Waterbury Arts Magnet. Good things happen when we come here. We were here last time and we announced the Everybody Learns initiative, which was involving the fact that not everybody's going to be able to get to school in the middle of a pandemic. Nobody was going to be left behind. Nobody's going to be left on the wrong side of the digital divide. And here we are some months later, and Miguel Cardona, our Commissioner of Education, is going there in front of the Senate and getting his confirmation hearing. And you probably heard President Joe Biden said, Miguel Cardona is our commissioner, going to be our Secretary of Education, thanks to what Connecticut was able to do to bridge the digital divide and make sure no kid gets left behind. So good things happen when we come to the Magnet. And, Steve, you're the guy saving lives. We're the guys trying to be your partner and do everything we can to give you the tools and the resources you need. Taking a look around here, talk about a team. Talk about, it takes a village. It's Jerry Reyes. You and I know. I mean, it's not simply a matter of go to Vans, sign up on your iPad, show up at the drive-through clinic, and everybody gets vaccinated. I wish it were that easy. There are so many people who are getting left behind. So many people that find the computer setup complicated, find 211 complicated, find 311 complicated. They come here. Neil O'Leary, was there showing me, we've got the desk where you can sit down and we'll explain exactly what you're doing, how you get vaccinated, how we make it easy for you, and why it's so important. And Neil said something else that I think is really worth remembering. Waterbury's been really smart. You're getting, 100 vaccines a day or something, and you've got the capacity to do 10 times that number of people. 10 times that number of people, and it's more important than ever now. It's more important to keep you safe. How was that second dose? Was it okay? You feeling good, aren't you? Tell your friends how important this is. We got this variant. It's not so much here in Connecticut, but this highly infectious variant, and we want to stay ahead of it. And the best way you stay ahead of it is to get people vaccinated. And you get people vaccinated, those that are most at risk, 75 and over, and within 10 days or so, 65 and over. And more importantly, or just as importantly, go into those vulnerable communities, go into those communities where people can't get left behind, go to those elder housing, go into those congregate settings that Neil was telling you about, telling people, we're going to bring the pop-up, we're going to bring the vaccine to you. But if you care about your health, you care about your family's health, you care about your community's health, get the vaccine. I'm getting to the age where I'm going to be eligible. I'm getting closer, and I can't wait for that opportunity. So I just hope that the Waterbury Arts Magnet School brings us the same good fortune in terms of bridging the divide and making sure that everybody should get vaccinated, does get vaccinated, that you did when it came to the digital divide. And last thing is, Neil mentioned, we're ready. Give us the vaccines. And I put them on the allocation committee. That was no walk in the park. Everybody is essential. We got that message. But I'm talking to the CEO of Pfizer this afternoon. I'm just telling them that this is, we're here to support you. They got a Connecticut base here, by the way, so remember your friends. Keep going with the vaccines. People know it's safe. People know it's effective. People know it keeps their community safe. People know that's how we're going to beat this COVID thing and break its back and get back to a new normal. And those days are coming. Spring is around the corner. Groundhog Day is 6 weeks. So we're going to get there. And that's the message I'm going to give them. I'm going to tell them I was just in Waterbury. And that's a community that's ready to get the vaccines and ready to have them delivered. Thanks, everybody.
Thank you, Governor. And speaking of courage and strong leadership, our school superintendent, Dr. Verna Ruffin, has hit the ground running in the almost 2 years that she's been with us, making amazing strides in our public schools, even during the pandemic, as the governor spoke of, with the, squelching the digital divide and getting 14,000 laptop computers into the homes of our students. Actually, it's more than that now that I think about it. It's about 15,800. But we're really doing well. But you know what? We're really going to be doing better because our kids are coming back to school tomorrow. Dr. Verna Ruffin.
Yeah.
Thank you, Mr. Mayor, and it's always a pleasure to have you here, Governor, and to really share in what we're doing here in Waterbury and what we're going to be able to do in the future. So thank you very much for your leadership. On a regular basis, I'm always listening to you and the messages that you have delivered. They are very courageous and they're timely and they keep people informed. And our mayor, who has been very progressive, has stepped forward and made certain that Waterbury is taken care of and that we have what I would term to be a true partnership. It's one thing to talk about partners and people give you things and people share a little bit, but this is a true partnership between St. Mary's Hospital. So Dr. Schneider, thank you and your staff. A true partnership with our state, a partnership with our mayor to do this in such a location that is convenient for our residents here in Waterbury. But I also think that it shows selflessness in terms of it's showing our students what needs to come first, and that is people. And I think that's sometimes easier said than done, because sometimes people think, yes, I'm all in, but not here. But that's not what's happening. You know, we have to do, and we are doing what's best for our students and our residents here in Waterbury. And I think this is an example of what that looks like, and it is an example in a pandemic. So, you know, a lot of emotion goes into decisions. So I want to thank everyone who is a part of this. I want to thank my staff. I see my COO, Will Clark, is here. He was a part of this, working with Adam, working with Cindy, working with the mayor's team, working with the hospital, working with everyone to make certain that we're able to execute and had a place that was safe and convenient, and that the flow was going to be convenient for all of our citizens, especially the elderly. So I'm very appreciative of that. But as an example for our students, this is what a true partnership looks like when you're all in this together, literally. So I'm very appreciative of that. And yes, we open schools in our hybrid model tomorrow. It is our expectation that over time, we will be able to extend that. We think that we're going to have anywhere from 30% to 40% of our students in person. And we anticipate that we're going to continue to grow that as we gain confidence in being able to return to in-person. And because of all of the partnerships and because of the great leadership that we've had from you, Governor, and you, Mr. Mayor, I believe that we are very well poised to reimagine education in Waterbury Public Schools. The technology divide no longer exists as far as the tool is concerned. Now we really need to extend the learning practices. So thank you very much for your leadership. Thank you for this important step in making certain that all of our residents are vaccinated.
Thank you, Doctor. And I just want to reiterate to the press corps, this is one mass vaccination site. The other site across town is in a great location. It's a partnership between Waterbury Hospital and Post University. They're equipped to do as many vaccines per day and per week as we are. They're also willing to go to a 24/7 model once we get the supply. And then there's CHC over at the mall. Right now they're doing testing, but they're also contracted with the state to do mass vaccinations over at the mall. That'll be a drive-up site. So, you know, we've got a lot of good things going on here, and as you have heard repeatedly, we're geared up, we're ready, the infrastructure's in place, and we're going to get to it as soon as we get the supply. Anyone that would like to ask questions of the governor, please, Governor, step forward. And
Ask questions of the mayor.
Well, could you tell us a little more about the rollout for the 65 and 74-year-olds? You just said 10 days, they should be able to start registering and get vaccinated. Can you elaborate?
Yeah. 10 days, provided we see what the flow of vaccines is going to be, Paul. So I don't want to get ahead of myself here. It could be 2 weeks. Right now, everything we've heard from the federal government, everything that we've heard in terms of people getting vaccinated, some towns have 80% of their 75-year-olds vaccinated already, some a little less than that. But the rollout's going to be sort of what it was for 75 and over. You can do it online, you can call 211, here in Waterbury 311, making it as easy as we can and comfortable as you can to go get that first vaccine and then that second vaccination 3 or 4 weeks later.
You released an interactive map, and you're going to be updating this information every Thursday. In Waterbury, the fifth largest city with 107,000 people, 107,560 people, roughly 5,600, 6,000 have received vaccinations of the 75 and over population. 24.5% have received vaccinations. This is a city with a large minority population. How concerning is this emerging vaccination divide, and what are you doing to close it?
It's less concerning when I come to the school like here and I see how aggressive Waterbury is in reaching out to populations that may not feel 100% ready to get vaccinated, or it's not easy for them to get vaccinated, or they can't go out and they got some conditions. We have to bring the vaccine to them, like Mayor O'Leary said. Look, there's no question about it. We got to work harder. I got to make sure that people get vaccinated. But so far, virtually every vaccine we've gotten from the federal government has ended up as a shot in the arm within a matter of days, more than just about any other state. And they gave us 50,000 extra doses the other day just to say you're getting the job done. I want to tell them, give us 500,000 extra doses. We'll show you we can get the job done.
Well, Governor, can you talk a little bit more about that? I mean, it's great that we're here and this clinic is here and today people are getting vaccinated. But can you talk a little bit more about those shortages? Because there are clinics across the state who have had to cancel appointments for folks because they don't have enough doses. I know maybe Health Network is one. So can you talk a little bit more about that there are these shortages for folks who are booked, but they have to get.
Yeah, it was a very short lag time. We would ask people, how many doses do you think you can get? Or they'd tell us what they needed. We'd tell them by Thursday, this is the amount of doses we've got from Operation Warp Speed, which is really not that fast. And then they'd get the doses 3 days later. So it was, we had to work very hard. I think things are getting better organized down in Washington, and they're giving us 3 weeks notice now. So Steve, we'll be able to tell you, give you a little more heads up in terms of what you can expect a week or two down the road, because people are making their appointments a week or two down the road.
So in terms of shortages, that should change by the end of this week, next week? Is there a timeline at the end?
Well, when you say shortages, let's say we're getting 55,000 doses a week. That's a shortage because I could use 255,000 doses a week. But in terms of knowing what we're going to get on a weekly basis, we have much better clarity today than we had a month ago.
So following up on that question about disparities, I know they have put out, it was the Department of Public Health, it was 24.5% here in Waterbury, but an area, I believe, like Wilton, I believe had like 85% over the 75 years old who had been vaccinated. Can you still talk a little bit more about what is happening? I know the mobile testing was mentioned. Is there anything more to close that disparity gap between towns?
Yeah, you've got the worried well. They dress as doctors. They put on a stethoscope. They drive in. They are, some are desperate to get vaccinated now. Some are a little more hesitant. Less every day, though. I think every day we generally have a friend or a friend of a friend that got vaccinated, know it worked, know that he or she feels a lot better. And in the meantime, what we're doing, as I said, is we're bringing the vaccines to you. If you won't come to us, we're going to come to you and make it easier for you to get vaccinated. Neil, do you want to talk a little bit about some of the pop-up work
Sure.
you're doing?
Thank you. And there's no question, and to Paul's point and to your point, there is a disparity that was discussed very deeply in our allocation meeting yesterday. And that is what, our advice and our input from our inner city partners has been. Look, in Wilton, there's a different demographic of people there, and the volume of people is 75 and older is much less. We have thousands. And the truth is that in our black and brown community, there's some reluctance still to get the vaccine. So that's hurdle number one. Hurdle number two is messaging, right? So people in those congregate housing, although they have access to social media and they have access to the television and the radio and the newspaper, they may or may not be following it closely. And that's what we learned yesterday. We started, well, actually, earlier in the week and a little bit last week, we started reaching out to the people who manage all of our senior housing buildings in downtown, and we asked them to start doing a survey about, how many of your people are actually coming out and how many are staying in, and that's when I talked about that statistic. So we've come up with this strategy, and I think it's a great strategy, honestly, because first of all, it keeps them safer because they're going to be within the lobby or even on the same floor of their building. That's where the pop-ups are going. So they need to just step out of their apartment and walk a few yards, and we're going to take care of them. Secondly, we're going to have the right staff there. So we're going to have the computers there. We're going to navigate the VAMs, put them right in the computer, shot in the arm, set up the second appointment. We're good to go. I think it's a matter of convenience, it's a matter of messaging, and it's a matter of recognizing and understanding the community that we serve. And the community we serve here, we have a very large senior population. And on top of that senior population, many, high percentage of those folks are disabled in many different ways. So we need to get to them, and that's why we're setting up. We bought 2 portable freezers for the vaccines already. We have them already. We're ready to go. We have 2 mobile units ready to go. And we have the pop-ups ready to go. Just a matter of getting the vaccines. We have been doing better. The picture is getting better. The light at the end of the tunnel is getting brighter. We've seen more vaccines this week than last week than the week before. You know, the real problem was the mixed messaging that came out of Washington some time ago, that there was going to be 20 billion of this and 20 million of that, and everybody was geared up and ready to go. I was glad. It was a good exercise for us to get everything in place, but the reality is that wasn't accurate information, and some of us, leadership especially, are paying that price right now. People are like, I'm ready to go, where is it? So Governor Lamont and others are working very, very diligently to make sure that the state is getting what we need. And the infrastructure, and it's not just in Waterbury, across the state, New Haven, Hartford, Bridgeport, small towns, medium cities, they're ready. It's just a matter now of getting the product. Thank you. Thank you. Yes?
So Governor, after your tour today, how does this compare with the other clinics across the state?
They've had me sort of quarantined for a while. But I can, you know, I've been to the drive-through clinics. I've been to the big community health centers. This is so community-based. I love to see the firefighters helping out with the vaccine. I love to see what the cops are doing. I love to see how the Guard is involved. I mean, talk about it takes a community. That's what strikes me. And by the way, these are all the advocates that go out to a lot of the seniors who are maybe a little hesitant. They're saying, I'm working down here at the Magnet School. Come on down, get vaccinated. By the way, right next door, you can get tested. I love the community base here. I think we're good. Thanks, everybody. Oh.
This was a bit off topic, not necessarily vaccine, but I believe it was the National Federation of State High School Sports. They actually revised their guidelines in terms of the tier with high, low, medium risk sports. And just was interested of wanting to know what you thought about that.
The only thing tougher than Neil on the allocation committee saying who's more essential than somebody else is being on the high school advisory board trying to say this sport is high risk compared to that sport. Let's say at this point our sports are open. I think you know, wrestling and some form of cheerleading are the two that are on pause right now. And so far I'd like to think that winter sports are going to move into spring sports. We have more and more people vaccinated, and that'll be less of an issue every day. Thanks, everybody.